have very good experience on it. Others have not.
That would be an issue between them and their physicians, and not for the
exactly.
future head of HHS to be putting out misinformation about the dangers of SSRIs and other antidepressant medication, spreading the stigma and the fear that we're actually trying to overcome.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
That's all I believe, too. Then you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was based on.
I was saying the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of suicidal, homicidal behavior.
Mr. Chair, I will submit to the chair the information that I have about what Mr. Kennedy has said, linking antidepressants to school shootings. Thank you.
Senator Young.
Thank you, Mr. Chairman. Good to see you, Mr. Kennedy. To follow up on that spirited exchange, in talking with you and reading about your vision for the department, you said one of your goals is to return public health agencies to the gold standard of scientific review. You've alluded to the gold standard a number of times today. So I'm going to give you an opportunity, uninterrupted, but hopefully not too extensive, to tell me and others what you mean by this gold standard.
The gold standard means real scientific research with replication of studies, which very rarely happens now at NIH. We should be giving at least 20% of the NIH budgets to replication. We should make sure that all the science is published with the raw data. We should make sure that the peer reviews are also published. And I'll give you a quick example. 20 years ago, NIH scientists did a study on Alzheimer's, which they said it was caused by amyloid plaque. After that, NIH shut down studies of any other hypothesis. 20 years later, we now know that those studies were fraudulent. NIH has funded 800 studies on a fraudulent hypothesis. And we've lost 20 years in figuring out a cure for Alzheimer's. And that's just one example. I could give you hundreds. We need to end that. We need to end the old boy system. We need to have replicatable science and be completely transparent about raw data.
Thank you, sir. In recent years, particularly during the COVID pandemic, there's been a lot of skepticism about our public health institutions. Some of this, I would say, is warranted, but it's now created a pervasive lack of trust from the public that these institutions are acting in bad faith or failing to act in objective criteria, failing, in short, to act in the best interests of the public. If confirmed, Mr. Kennedy, how will you work to regain the public's trust? I suspect it will take some time in these important public health institutions.
Through radical transparency, I'm going to make the reason people don't trust the public health agencies is because they haven't been trustworthy. And you gave the example of COVID. At the beginning of COVID, everybody was rushing to get that vaccine. We had over 90% vaccination uptake.
Yes, sir.
CDC's most recent recommendation is that Americans take the 8th booster. Only 23% of Americans are complying. That means 77% of Americans no longer trust CDC, and that is the problem.
Yes, sir. In the absence of full information, might it, I think I agree with you, but I want your response. Might it make sense to share that absence of full information with the American people, that uncertainty? I think one of the things, by observation and experience, that I saw during the pandemic, because we had certain prominent doctors appear on television and indicate, no, you absolutely must not wear a mask. 2 weeks later, it's yes, you must wear a mask. But they were certain. And they even demonized people for not following the latest science, knowing there's a high level of uncertainty in that science. Would a measure of humility and, as you say, radical transparency demonstrates humility, help rebuild trust over a period of years?
Absolutely. We need to tell Americans what we don't know. We need to make sure studies that reach a null hypothesis are also published. And that doesn't happen.
Sir, I think you are right about why healthcare costs are so high in the first place. The answer is indeed chronic disease. 90% of our healthcare spending goes towards managing it, as you say in your open statement. It's not in the main because of waste, fraud, and abuse, although we know some exist. It's not in the main because we have greedy executives at innovative, world-class companies. It's not in the main because we haven't yet adopted an unsustainable Medicare for All scheme. It's because of this. So I'm encouraged that you intend to make that a point of emphasis as it pertains to your future leadership. I will say, with respect to COVID, it's not over for a lot of Americans. It's not over. I know the mission accomplished banner was convenient for the last administration, but as we continue to navigate the ongoing impacts of the COVID pandemic, we have many individuals here in the United States and around the world who are suffering from long-term health effects that significantly impact their quality of life, work, and daily activities, and they've been largely ignored. Funding for long COVID research was appropriated by Congress in December of 2020, followed by additional funding directed by the Biden administration in February 2024. Patient groups and industry publications have criticized the slow pace of clinical trial design and enrollment. If confirmed, will you collaborate with healthcare providers, researchers, and effective communities to better understand and mitigate long COVID's impact? Yes or no, please?
Absolutely, Senator. There's 16 million Americans.
Will you commit to prioritizing long COVID research and integrate this work into broader healthcare policies? Yes or no, please?
Yes.
Patient groups, experts, and industry publications have raised concerns around existing long COVID funding being spent on observational research. In particular, criticism was directed towards recover funding being used to duplicate existing findings instead of funding trials for potential treatments or diagnostics. If confirmed, Mr. Kennedy, will you work with Congress so that going forward, long COVID funding will be directed primarily towards trial or novel research directions and not replicating existing observational research? Yes or no?
Absolutely, Senator, with enthusiasm.
Thank you so much. If confirmed, how will you create a balance between your personal priorities of chronic disease and healthy lifestyle and the ongoing critical work of the department in areas that are focused on incentivizing and advancing innovation in modern medicine and pharmaceutical discovery?
I think innovation is going to be the key to public health. And we have a unique opportunity now in history because of AI, because of telemedicine, and because of the quality of people that are now coming to HHS to actually save public health. But it's all going to rely on innovation, and I don't want to do anything that inhibits or impairs the pace of innovation.
That's encouraging. From approving AI algorithms to determining Medicare coverage, we certainly need more innovation, and we need good people in the department to assist with that effort. So I'll follow up with a question about how you're going to attract and retain good people. Thank you, Chairman.
Sorry to shut you down a little faster than I did the others, Senator. We are up against a vote deadline here, and we have one more senator who gets his full time. I hope you'll keep it as close to 5 minutes as you can, Senator Welch.
Well,
and then I've promised Senator Wyden, 5 more minutes?
To be divided 1 minute with my colleagues getting 1 minute.
And then if we can do that, we can get over to vote before they call the vote on the floor.
Thank you very much. Thank you, Mr. Kennedy. And as you know, I'm have great reverence for your family. I'm from Massachusetts. When I got out of college, I was in the first class of Robert Kennedy Fellows, the memorial created by your family to honor the service of your father. I do community organizing in the west side of Chicago. And I certainly admire your energy in your effort here and desire to serve. You know, there's a couple of things that are really important here. This is not just about a debate on vaccines. It's a debate about the qualifications, experience, and priorities as to the person that will head Health and Human Services. And it's not just about what your answers are today or what the questions are. It obviously has a lot to do with your whole record and your whole history. Your sister in her letter, or pardon me, your cousin in her letter said, you've always been charismatic, able to attract others through the strength of your personality, willingness to take risk and break rules. That's, I guess, an attribute, but it can be a danger. The question I fundamentally have is whether your willingness to disrupt and maybe break rules is going to be dangerous and destructive. The character questions we didn't go into here, but there's some sketchy things. You've acknowledged your history with heroin. You've gotten over that. But there's incidents that do, I think, concern the question of whether the stability is there to be in charge of this major organization. And that's compounded by my concern that you don't have any experience managing a large organization, that you don't have any experience in government. So those are things that have to be taken into account. But the issue for me is also priorities. A lot of your engagement in health has been on vaccines, big important issue. You actually disagreed, as I understand it, with President Trump about Operation Warp Speed. I think President Trump deserves a lot of credit for Operation Warp Speed. He knew we had to get a vaccine. And these other issues about a mask and whether you should wear it, whether when you got your groceries, the bag had to be left outside, remember that in the very beginning? Those are incidental to the core question that the president believed we had to have a vaccine. And you contested that. That worries me. That really deeply worries me. The other questions, Senator Cassidy asked you some questions about our healthcare system. I happen to believe that our healthcare system is profoundly broken. And it's not just about the chronic illnesses. That's about our diet, that's about our exercise. But we are getting premium increases in Vermont of 20% a year, 25% a year. And it's busting the bank for taxpayers, it's busting the bank for our wonderful Vermont employers who care about having health insurance that they can provide to their employees. Senator Cassidy asked you a couple of questions about how you would reform Medicaid, and I didn't hear an answer. You mentioned that you thought Medicare Advantage was good. You have a good plan. No focus on what an incredible ripoff was reported in the Wall Street Journal by United Healthcare, which was marketing Medicare Advantage and then paying doctors and nurses where they had assignments essentially to diagnose illnesses that didn't exist. So they made billions and billions of dollars. And I've seen nothing coming out of the Trump administration, and I've seen nothing coming out of your advocacy that is going after what is a rampant abuse by the insurance companies and overcharging people and not doing the job. And by the way, the United Healthcare people, when they did that, they overdiagnosed. When the person really got sick, they dumped them. They dumped them. Go to the nursing home on your own. That's a broken healthcare system. We spend the most and get the least. And I think there should be collective anger about this on both sides because all of our people are dependent on that healthcare system. And you're going to be working for a president who's on a lawless rampage right now, okay? He has done something reckless with the pardons to these cop beaters. I'm appalled by that. But that's just reckless. That's not illegal. He's impounded money. So right now, the Medicaid website went down. He's impounded money. So the community health centers that Senator Warner was talking about are up in the air as to what they can do. Do you believe that a president can impound money that has been appropriated by Congress?
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem, and
All right, I don't have time.
I
We've got
just
to get
wanna-
over to vote, so we can
But
do this.
but you've asked me 5 questions. You got to give me a chance to answer one of them.
Please be brief.
Yeah, I brought in, if I get confirmed, I've already appointed a general counsel. The first time in history, he's a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia. I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about-
I agree with you 100%.
All right, what about impounding, a president impounding money that, among other things, goes to healthcare?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution. I'm going to take an oath to uphold the Constitution, and I will administer the law and uphold the Constitution.
Thank you.
Mr. Chairman, I believe under what we've discussed, I control 5 minutes. I'm going to take 1 and give 1 to each of my 4 colleagues that remain.
All right, and I would just say this vote, they're going to call it in about 8 minutes.
Thank you.
So we have very little time.
2 hours ago, colleagues, I asked Mr. Kennedy to reconcile his many anti-vaccine statements with his handful of pro-vaccine statements. Instead, he gave us a word salad and ducked the issue. The same was true, Mr. Kennedy, with respect to measles, where you wrote a book playing down the threat, of measles, even though American families are very concerned about it, and apparently families are still mourning in Samoa. And my last point would be that Mr. Kennedy said today really wasn't about him. And I just want to tell him it is all about you, because I find your presentation to be both untrustworthy and unprepared, because my colleagues have been seeing back and forth between Medicare and Medicaid, and it's not clear which program you're using when. So I want colleagues to know there is a lot more information to learn about Mr. Kennedy before we vote. I'm going to urge that to my colleagues on both sides of the aisle to not make decisions on the basis of this session. I thank you for the additional time. And I guess my next minute is Senator Whitehouse, Senator Warren, and Senator Smith.
And again, 1 minute each, please.
Senator Warnock.
There's been a lot of conversation about late-term abortions here, and I just want to make clear what Rhode Island OBGYN doctors describe as what is almost always happening when a late-term abortion is needed. It is a childbirth gone wrong. The family has painted the room, it has bought the crib, maybe even decided on the baby's name, and has gone to the hospital to welcome the new baby into their family in what is supposed to be a happy event. And then things went wrong. Then the alarms started pinging. The lights started flashing. The medical professionals started rushing in. And the question became, who lives and who dies? The mom's life is often at risk, and she may have other children she needs to care for. The baby's life may be at risk, and one or both may die. In that environment, the doctors and the family own that decision. Government has no place in that room at that point. And I think we need to understand when this late-term abortion gets bandied about, what you're dealing with is a tragedy that is happening to a family who wanted that child and have suddenly been confronted with a moment in which they have to make what is probably going to be the worst decision of their lives. And to try to shove the state legislature into that room is really offensive, really morally wrong, and I just want to make very clear what Rhode Island OBGYNs tell me is the situation when these procedures have to be deployed.
Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I wanted to ask about your role in the 2019 measles outbreak in Samoa. In July 2018, 2 children died immediately after receiving a measles vaccine that nurses had mistakenly mixed with a muscle relaxant. The nurses get charged with manslaughter, but vaccination rates go down. I asked you about this in my office. You told me flatly that your visit to Samoa had nothing to do with vaccinations. We now know that's not true. I have the documentation. You met with the Prime Minister. You talked about vaccinations. You met with an anti-vaccine influencer who described the meeting as, quote, profoundly monumental for this movement. So what happens? Vaccinations go down, there's a measles outbreak, and children start dying. But you double down. You didn't give up. Just 4 days after the Prime Minister declared a state of emergency, 16 people already dead, you sent a letter to him promoting the idea that the children had died not from measles, but from, quote, defective vaccine. You launched the idea that a measles vaccine caused these deaths. You are a very influential man. In fact, you are called the leader of the disinformation dozen. UNICEF and WHO, the World Health Organization, investigated this. They say the claims are false. It is not biologically possible what you claimed, and yet ultimately more than 70 people died because they didn't get vaccines. So my question is, do you accept even a scintilla, just even a sliver of responsibility for the drop in vaccinations and the subsequent deaths of more than 70 people? Anything you do differently?
No, absolutely not. There were 2 incidents in which children died. In 2015 and again in 2015, it was from the measles vaccine. That's what the New Zealand General Hospital found. The government of Samoa banned the measles vaccine after the 2018. I arrived in July of the next year after the ban had been in place for a year.
Mr.
And
Chairman,
the measles,
understanding that you wanted to hold this to a minute and that I don't get to present all the facts and documentation I've got, how about if we just decide to make entries for the record on exactly what the record shows about Mr. Kennedy's participation? And I think he's answered the yes or no question. He takes no responsibility.
Senator Warren, we will
We'll
do that. And
differently.
Mr. Kennedy, and to all the senators, every senator knows that following this hearing, they will be able to ask you questions off the record, and you will be able to put answers back onto the record. So please give that answer. I apologize that we're shutting you off for giving a full response right now. Senator Smith, and we are way over time.
Thank you, Mr. Chair. So, Mr. Kennedy, you have said that you want to give infectious diseases a break for about 8 years. You spoke about this with Senator Cantwell. My question to you has to do with avian flu. Over 100 million birds culled. The disease has spread to dairy cows, and there are now 67 confirmed human cases and 1 death. So, Mr. Kennedy, do you intend to give research on bird flu a break?
no, I intend to devote the appropriate resources to preventing pandemics. That's an essential part of my job.
What do you think is causing the avian influenza?
I think the H5N1 virus is.
So that's good to hear, because in a recent book, I will submit this for the record because we don't have that much time, Mr. Kennedy has questioned the scientific basis for germs causing disease and the power of vaccines and antibiotics.
I've
to
never
cure
questioned
disease.
that, Senator.
Well, I will submit that for the record.
Thank you. Senator Warnock, 1 minute.
I like the way you said that to the Baptist preacher. Thank you so much, Mr. Kennedy. Based on our conversations, it's my understanding that you support work requirements in Medicaid. In 2020, President Trump approved a proposal from Georgia state leaders requiring Georgians to jump through a number of onerous bureaucratic hoops and fill out even more paperwork to verify work and get access to health care. I ask this as someone who represents a state that has not expanded Medicaid. The federal government, because of this waiver, spent $70 million on Georgia's Medicaid waiver. 82% of that went to administrative costs. The point that I'm making is that the folks that they're insisting need to work, 90% of those folks are working, they are caregivers, or they have a disability. Let me give you one example. A woman I think of all the time, her name is Heather. She's a traveling nurse from Dalton, Georgia, who falls into the Medicaid coverage gap. Heather experienced a series of small strokes, leaving her unable to work full-time. She's dedicated her life to caring for patients, but now she can't afford her own medical care, out-of-pocket costs, because she doesn't make enough to qualify for tax credits to buy private insurance. What does Heather need? Does she need work requirements, or does she need access to health care so she can finally get healthy and get back to work?
The individual that you described would need health care and not a work requirement.
Thank you.
Thank you.
Thank you.
Thank you, and we are done with the questioning now. Mr. Kennedy, I apologize to you, to the audience, and to all of my colleagues to have to rush it here at the end, but we have a vote on the Senate floor that they're going to close in about 3 minutes. I want to thank you for appearing before this committee. You have been accessible to the members and staff on both sides of the aisle of the Finance Committee throughout a rigorous process, and I want the whole world to know that you spent hours in meetings answering questions outside of this hearing and providing documents and responses on issue after issue after issue. You've gone through the most thorough vetting process that any committee in this Congress puts anybody through. And I think that you have come through well and deserve to be confirmed. I would like to remind my colleagues that the deadline for submitting any questions for the record is 5 p.m. today, 5 p.m. today. And Mr. Kennedy, we ask that you respond to those questions as quickly as you possibly can. With that, I'm going to leave you in this room.
Ranking Member Wyden and members of this distinguished committee, I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I also want to thank Cheryl and Kik and Bobby and all of my other children who are here today, and all the many members of my large extended family for the love that they have so generously shared. Ours has always been a family that has been involved in public service, and I look forward to continuing that tradition. My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in the small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he is more than just concerned for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask why are healthcare costs so high in the first place. The obvious answer is chronic disease. The CDC says 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all of our people healthy again. There is no single culprit in chronic disease. Much as I have criticized certain industries and agencies, President Trump and I understand that most of their scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure the committee is clear about a few things. News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
We'll have order. Please proceed, Mr. Kennedy.
I am pro-safety. I worked for years to raise awareness about the mercury and toxic chemicals in fish, and nobody called me anti-fish. And I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine. Nor am I the enemy of food producers. American farms are the bedrock of our culture, of our politics, of our national security. I was a 4-H kid, and I spent my summer working on ranches. I went to work with our farmers. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. Maha simply and pray to God that he would put me in a position to end the chronic disease epidemic and to help America's children. That's why I'm so grateful to President Trump for the opportunity to sit before you today and seek your support and partnership in this endeavor. I will conclude with a promise. The members of this committee, to the president, and to all the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. We will scrutinize the chemical additives in our food supply. We will remove financial conflicts of interest from our agencies. We will create an honest, unbiased gold standard science at HHS, accountable to the President, to Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy. Mr. Kennedy, I will begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond to them promptly. Mr. Kennedy, you have emphasized the importance of nutrition in preventing and managing chronic disease, improving health outcomes, and reducing health costs. I share your interest in the relationship between our diet and our well-being. And if confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why you are passionate about the nutrition-oriented disease prevention and what you have learned?
Yes, Mr. Chairman. I had 11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic. When my uncle was president, 2% of American kids had chronic disease. Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. With 77% of our kids cannot qualify for military service. When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through his or her office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 to 1 in 1,500, depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just an economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, and we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. The federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware of it. I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, or Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
Thank you. Senator Wyden.
Thank you very much, Mr. Chairman. Before I begin my questions, I'd like to start by entering into the record a letter the committee received from Ambassador Carolyn Kennedy outlining what she believes is Mr. Kennedy's lack of personal fitness for the office.
Without objection.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing, and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, no vaccine is safe and effective. In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, you would do anything, pay anything to go back in time and not vaccinate your kids. Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this, he asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I don't want to, I want to emphasize
Mr. Kennedy, the facts.
The committee will be in order. And to the audience. Hold on for a second, Mr. Kennedy. To the audience.
Comments from the audience are inappropriate and out of order. And if there are any further disruptions, the committee will recess until the police can restore order. Please follow the rules of the committee. Mr. Kennedy, you may proceed.
I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa, in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government in Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that, if you let me finish, Senator.
You have had some time,
If you let me finish, Senator, if you let me finish, there are 83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
We need to move on. Senator Grassley.
Welcome. I'm going to do like I did in my office. I'm just going to make some points to you. I got about 7 I want to quickly get done. And then at the end, I'm going to ask if you disagree with anything I say, and then address those things you disagree with. I'll make sure I save time for you to do that. A key responsibility of each member of Congress is oversight. Oversight allows us to hold bureaucrats accountable to the rule of law, and it helps keep faith with taxpayers. I expect HHS to provide timely and complete responses to congressional oversight. Number 2, PBMs, something you and I discussed in our office. I've been working to hold pharmacy benefit managers accountable in order to lower prescription drug prices. I expect you to work with us to hold PBMs accountable, and that may even asking your support for legislation that's before the Congress. Drug pricing. Senator Durbin and I have for a while been trying to get a bill passed that requires price disclosures on TV ads for prescription drugs. Knowing what something costs before buying it is just common sense. President Trump tried to do this by regulation in his first term. Vice President Vance co-sponsored our bill last Congress. I ask you to support this bill, or if you can do it by regulation, to do it by regulation. On rural health care, the previous administration dragged its feet in opening up slots for rural community hospital demonstration programs. It also ignored concerns from rural pharmacies when implementing changes to Medicare Part D, and ignored rural needs when it comes to distributing physician residency slots. I expect you to prioritize rural Americans' health care needs. On agriculture, in our meeting earlier this month, we talked at length about agriculture. You prefaced the conversation by saying you will not have jurisdiction over these issues. I expect you to leave agricultural practice regulations to the proper agencies, and for the most part, that's USDA and EPA. On dietary guidelines, I've sent letters to the Secretaries of Agriculture at HHS requesting that they provide information regarding conflicts of interest on the Dietary Guideline Advisory Committee to increase transparency. I expect you to provide Congress with confidential financial disclosures from the Advisory Committee before finalizing dietary guidelines, so we know that nobody has a vested interest in it, is having undue influence. Lastly, HHS, Office of Refugee Resettlement Oversight. Last year, I expanded my investigation into HHS's Office of Refugee Resettlement. I wrote 24 contractors and grantees whose job it is to place unaccompanied children with sponsors. In many cases, children have been placed with improper vetted sponsors, placing them at risk of trafficking. The Biden administration's HHS directed these taxpayer-funded contractors and grantees to not respond to my inquiry. This is obstruction by the executive branch. I expect you to produce to me the records and data I've requested and instruct HHS contractors to fully cooperate with my investigation. I also expect HHS to not retaliate against any whistleblowers, including those who identify ORR's failures in vetting sponsors of unaccompanied. You got 45 seconds to respond if you want to.
I agree with all of those provisions, Senator. My approach to administration HHS will be radical transparency. If members of this committee or other members of Congress want information, the doors are open. I've spent many years litigating against NIH and its sub-agencies, HHS and its sub-agencies, NIH, CDC, FDA, on FOIA issues, trying to get information that we, the taxpayers, paid for, and oftentimes getting back redacted copies after a year or 2 years of litigation. That should not be the case, and if Congress asks me for information, you will get it immediately.
Thank you.
Thank you. Senator Cantwell is next, but until she returns, I will move on to down the list, and that would be Senator Cornyn.
Mr. Kennedy, welcome to you and your family, and congratulations. I appreciate Senator Grassley raising the issue of the Office of Refugee Resettlement within the auspices of Health and Human Services. I think this may surprise people, but that's actually the responsibility of HHS, the Office of Resettlement Relocation. Under the previous administration, as Senator Grassley alluded, there were roughly 500,000 children, unaccompanied minors, that were placed with sponsors in the interior of the United States. The previous administration took the position that it was not the federal government's responsibility once these children were placed with these sponsors. But the New York Times, in a series of investigative stories, pointed out that tens of thousands of these children, when they tried to follow up and find out how they were doing, whether they were going to school, whether they were being trafficked or abused, there was no answer, and they took the position it was not their responsibility. So I look forward to working with you to find those children and to make sure that they're not being abused. Millions of Americans are experiencing mild to moderate mental health and substance abuse issues, yet many struggle with timely and effective access. Primary care physicians are most likely to be seeing these individuals as opposed to a specialist, and it makes it important that these individuals, primary care physicians, be trained in patient-centered care, which would strengthen the integration of behavioral health care with primary care services. Is this something that you are concerned about, something you'd be willing to work with us on in order to implement?
Yes, Senator, let me just reassure you that President Trump has personally spoken to me about locating those 300,000 children who disappeared over the last 4 years.
I don't think anybody has a fully accurate number, but it's hundreds of thousands, I agree.
And many of them we know have been sex trafficked and childhood slavery, and it is a blight on America's moral authority, and we need to find those kids. In terms of addiction services and substance abuse services, This is a priority for me. It was a priority for me when I was running for president during my campaign. I was a heroin addict for 14 years. I've been 42 years in recovery. I go to 12-step meetings every day, so I hear the stories every day. And I hear the many stories about denial of, or the barriers to access to care. And we need to improve that. And answer specifically to your question, I think we can do that through GME, which is a program that is funded by HHS, that is the largest funder for medical school students. And that's one of the things for primary care physicians should understand addiction care. Addicts almost always go through a cycle where there is a moment where they hit periodic bottoms where they're ready to go into treatment. But it's fleeting and it's momentary. And we have that opportunity to save their lives. And then if we miss that little short window, they're off to the races again.
I appreciate your answer. Our time is short. Let me get to one more question that I think is very important. Under the first Trump administration, the number of people receiving HIV treatment in Africa through the President's Emergency Plan for AIDS Relief, otherwise known as PEPFAR, it increased, this is during the first Trump administration, from 13 million people to 18 million people across 50 countries, primarily in Africa. Africa has about 1.3 billion people today, or in 2021. It's projected to have 2.5 billion people by 2050, or 25% of the global population. In 2020, PEPFAR reported that 2.8 million babies were born without HIV. That was something that would not have happened but for the PEPFAR program. So it has simply been one of the most successful public health programs in the world and saved approximately 26 million lives. Failure to continue this program, in my view, would risk ceding that leadership to adversaries like China. And I'd like to know whether you support the objectives and goals of PEPFAR, and would you work with me and my colleagues to make sure that this program continues to provide life-saving antiviral drugs to people who are most in need?
I absolutely support PEPFAR, and I will happily work with you to strengthen the program.
Thank you. Senator Bennett.
Thank you, Mr. Chairman. Thank you, Mr. Kennedy, for being here this morning. And I think that, Mr. Chairman, we are truly through the looking glass this morning here in the U.S. Senate, and this committee is being asked to fulfill a really important responsibility, which is to decide whether to confirm Mr. Kennedy to one of the most important health care jobs in America. And the reason I think it's so important is for many of the reasons you said in your opening statement, which is that we live in the richest country in the world, and we have some of the worst health outcomes of any industrialized country in the world. We live in the richest country in the world, and we have some of the lowest life expectancy rates of anybody in the industrialized world. I was a school superintendent before I was in this job, Mr. Chairman, and I can tell you that Mr. Kennedy's right, that when I look at the kids in the Denver public schools, if we don't change the way we eat in this country, 40% of them are going to suffer adult diabetes as a result of their diet. And we're, as I said, spending more than any other country in the world, and our families, every single person's constituents in this Senate are facing chronic shortages when it comes to health care. My friend from Texas, Senator Cornyn, has been a champion on mental health care. We have an epidemic, as he knows, across this country in mental health care, partly because of what the massive social media platforms that were sitting behind the President of the United States have inflicted on our children for their profit in the last decade or so. So we have no shortage of challenges to confront, and I even agree with some of the diagnosis of of Mr. Kennedy, what is so disturbing to me is that out of 330 million Americans, we're being asked to put somebody in this job who has spent 50 years of his life not honoring the tradition that he talked about at the beginning of this conversation, but peddling in half-truths, peddling in false statements, peddling in theories that, create doubt about whether or not things that we know are safe are unsafe. Not that every vaccine in America is unsafe, not that you can't possibly have an adverse reaction, but that parents and children in my old school district and school districts all over this country would be better off not getting vaccinated than getting vaccinated. Unlike his own children who were vaccinated, unlike the people he invited to his house in Los Angeles for their party who were vaccinated. For everybody else, it's about peddling these half-truths. And he says it with such conviction that you want to believe him. And Mr. Kennedy, I just have there are many, many things in the record, but I hope that you could answer these questions, yes or no. I've tried to ask these in a manner that's faithful to what you actually said, because I didn't want to have a debate about whether you actually said them. So I'm asking you, yes or no, Mr. Kennedy. Did you say that COVID-19 was a genetically engineered bioweapon that targets black and white people, but spared Ashkenazi Jews and Chinese people?
I didn't say it was deliberately targeted. I just quoted an NIH-funded and NIH published study.
Did you say that it targets black and white people but spared Ashkenazi Jews?
I quoted a study, Your Honor. I quoted an NIH study that showed that
I'll take that as a
certain
yes.
races
I have to move on,
disproportionately.
I have to move on. Did you say that Lyme disease is highly likely a materially engineered bioweapon? I made sure I put in the highly likely. Did you say Lyme disease is a highly likely militarily engineered bioweapon?
I probably did say that.
Did you say that?
And that's what the developer of
I
Lyme
want all
disease
of our
said.
colleagues to hear it, Mr. Kennedy. I want them to hear it. You said yes. Did you say that exposure to pesticides causes children to become transgender?
No, I never said that.
Okay, I have the record that I'll give to the chairman, and he can make his judgment about what you said. Did you write in your book, and it's undeniable, that African AIDS is an entirely different disease from Western AIDS? Yes or no, Mr. Kennedy?
I'm not sure if I made that.
Okay, I'll give it to the chairman, Mr. Kennedy. And my final question, did you say on a podcast, and I quote, "I wouldn't leave abortion, to the states. My belief is we should leave it to the woman. We shouldn't have the government involved, even if it's full term." Did you say that, Mr. Kennedy?
Senator, I believe that every abortion is a tragedy.
Did you say it, Mr. Kennedy? This
believe-
matters. It doesn't matter what you come here and say that isn't true, that's not reflective of what you really believe, that you haven't said over decade after decade after decade, because unlike other jobs we're confirming around this place, this is a job where it is life and death for the kids that I used to work for in the Denver public schools, and for families all over this country that are suffering from living in the richest country of the world that can't deliver basic health care and basic mental health care to them. It's too important for the games that you're playing, Mr. Kennedy. And I hope my colleagues will say to the president, I have no influence over him. I hope my colleagues will say to the president, out of 330 million Americans, we can do better than this.
Thank you. We need to move on. Senator Cassidy.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About
dual eligibles?
Well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working with the target population. Most Americans, like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was originally designed for a target population, the poorest Americans. It's now been dramatically expanded, and the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that
figure out other options.
Obviously, you've thought about that, and I appreciate that. What reforms do you recommend?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability, and to transition to a value-based system rather than a fee-based system, rather than a service-based system.
On Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
Listen, I think that there are many, many options with telemedicine, with AI right now, and, there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest providers.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee-for-service.
Traditional Medicare?
Yes.
That's their choice right now. I think 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. But people can't afford it. It's much more expensive. In answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so it would bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing it. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do with repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator,
Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign, and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days, funding and any kind of further work, NIH research?
As Chairman Crapo pointed out.
I'm not asking for, I love Mike Crapo. I'm asking you. You're up for a very important position.
As he pointed out, Senator, the portals that were closed were not closed as a result of the Trump
administration. Let me just tell you, I'd like you to explain, excuse me, sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night.
I'm saying that the Trump administration
you don't know if you raised a lot of money.
The Trump administration has made clear that it does not want to freeze benefits for any Americans under Medicaid or Medicare, and I do not want to dismantle Medicaid.
The freeze is affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees?
Well, President Biden this year changed 3,000 employees at HHS. 3,750 at NIH.
You're 2,200. What departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out.
Let me just, I'm down to a minute 30. The chairman's been generous with with colleagues on both sides. I may have to go a couple minutes over, but let me just say, so let's just answer, this would be, this, I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to prevent things like salmonella?
Senator, there's 91,000 employees.
So that, I take that as a, that's a simple yes, and I'm going to take that as a no.
Run that agency
I take that as a no.
without-
Will you, actually, we talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
So I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly.
So you're going to excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president.
So does that mean you're not going to freeze the funding that is currently frozen?
The White House has made clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to health care that come from the federal government, they come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to commit, try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.
Senator Langford.
Mr. Chairman, thank you. Mr. Kennedy, it's good to see you again. We had some great visits in my office. We've done some follow-up calls to be able to go through. You and I have talked about 100 different issues and backgrounds and things. You've been able to address a lot of them today and just different questions to be able to clear up social media rumors and the things that are out there on it. So I do appreciate that. We've talked about pharmacy benefit managers. We've talked about the nursing home rule the Biden administration put down. We talked about your views on agriculture and commercial and row crop agriculture. We've talked about food issues, and you made it very, very clear. You're not going to tell Americans what to eat, but you do want Americans to know what they're eating. And I think that's a pretty fair perspective on that. I do want to talk to you about some areas that you and I have talked about as well. We have some disagreements, you and I, on the issue of life. And when life begins on that, you've been very outspoken on that. And we've had some good opportunities to be able to talk about that. Title 10 is specifically in the HHS area. This has been an area that has been interpreted for a long time, and President Trump in the first administration interpreted that rule to say that his administration will prohibit the performance, referral for, or promotion of abortion as a part of the Title 10 program. That he made that very clear in the first administration. Obviously, that's his decision to make again on that, on how he wants to handle that, and he's made a lot of public statements on that. The Biden administration not only reversed that, not only rescinded that rule, but they went one step the other direction. In my state in Oklahoma, as you and I have talked about, the Biden administration cut off funding to the state of Oklahoma for AIDS testing, for breast cancer screening, and for other areas of poverty health care because my state didn't promote abortion. It wouldn't provide. If my state wouldn't promote abortion in the state, we got cut off for federal funds for AIDS testing and for other things. My simple question to you is, how are you going to handle Title X on that? I saw how President Biden handled that in the punitive measures that came on my state for those that are in rural health care. How are you going to handle Title X?
I'm going to support President Trump's policies on Title X. I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title X. I serve at the pleasure of the president. I'm going to implement his policies.
Thank you for that. President Biden, when he came in, immediately closed down the Office of Civil Rights and Conscience Protections within HHS. There's a statement that's come out recently that he's going to reopen that office again to be able to protect the civil rights of Americans. One of the things that Javier Becerra did immediately when he came into HHS was conscience protections for medical professionals that were being compelled against their conscience to perform medical procedures that violated their conscience. Javier Becerra stepped in immediately into HHS and withdrew that and said, no, the federal government will tell you what you believe about these issues. You don't have conscience protections anymore, and refuse to protect those folks. Will you step in and say that healthcare individuals have the right of conscience again, as the federal law allows?
Yeah, I mean, the first thing that occurs to me when you ask that question is, what patient would want somebody doing a surgery on them that, believes that the surgery is against their conscience being forced to perform that? I don't know anybody who would want to have a doctor performing a surgery that the doctor is morally opposed to. Listen, I came from a family that was split on life and choice. I have cousins today who believe that abortion at any stage is equivalent to homicide. Now, there are other people who believe the opposite. But the good thing in my family that I really loved is that we were able to have those conversations and respect each other. And I wish that we could do that nationally. And if forcing somebody to participate in a medical procedure as a provider that they believe is murder does not make any sense to me. We need to welcome diversity in this country. We need to respect diversity, and we need to respect each other when we have different opinions, and not force our opinions on other people.
Yeah, thank you for that. The FDA, under the Biden administration, changed the rules for the chemical abortion drug and said you no longer need to see a physician. So if you have an ectopic pregnancy or all kinds of, don't even go anymore to see a physician. But they also changed an area that has been, something that's been very particular, you've talked about a lot, and that's transparency. They changed the position and said, don't tell us if there's a side effect on this drug unless she dies. But other than that, don't tell us anymore. Literally, don't give transparent information to the American people or to the women who take this drug anymore. We don't want that reported. My question to you is, will FDA move to be able to actually give transparency to the American people and to say, this drug is no different than any other drug. We're not going to protect it just because it's political for some folks. People should know side effects on this drug, and there should be reporting.
Yeah, I mean, it's against everything we believe in this country that patients or doctors should not be reporting adverse events. We need to know what adverse events are. We need to understand the safety of every drug, mifepristone and every other drug. And President Trump has made it clear to me that one of the things, he is not taking a position yet on mifepristone, a detailed position, but he's made it clear to me that he wants me to look at safety issues. And I'll ask NIH and FDA to do that.
Thank you.
Senator Whitehouse.
Thank you, Chairman. Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. 2 things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013, and frankly, you frighten people. 2, I want to air harms that Rhode Island has experienced from a remorseless, senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid, and the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra family doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted, and the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money. serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record. Without objection.
Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing is a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately, Mr. Chairman,
reproduced around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
Well, I guess at that point then we will move on to Senator Daines.
Mr. Chairman, thank you. Mr. Kennedy, I'm glad to see you here this morning. I listened to your opening remarks, and you mentioned that you want to make HHS the gold standard of science. I have found my engagements with you, both behind closed doors in my office, as well as listening to you publicly, to be very thoughtful and science-based. I applaud that. I thank you for that. And I realize this will likely be a very partisan vote on this committee and on the Senate floor. But let the record state there are 3 medical doctors on this side of the dais. I'm a chemical engineer. We believe in science. I'm thankful that you do too, and you made that comment in your opening remarks. I want to talk about agriculture for a moment. We talked about our common love for Montana. You've been to Montana many times. It's a wonderful state. A lot of folks have discovered it. They watch the show Yellowstone, and people are coming and moving into our state, but it's an amazing place. But as you know, agriculture is our top economic driver in Montana. We produce some of the highest quality crops, the best livestock in the country and the world. Our farmers and our ranchers are truly some of the most effective environmental stewards in ensuring we have a safe food supply chain in the world. I share your view that protecting the integrity and safety of our food supply is of utmost importance. I appreciate the research happening in places like Montana State University to help farmers produce resilient, healthy, and safe crops, as well as their agricultural practices. You mentioned you were a 4-H kid growing up. I think our 4-H kids and our FFA kids are some of the best kids in America. My question for you, Mr. Kennedy, is if confirmed, as I'm listening to my farmers and ranchers talk about the future, will you commit to working collaboratively with partners at USDA, at the relevant federal agencies, as well as our Montana farmers and ranchers before implementing any policy that might affect or impact food supply?
Absolutely will make that commitment. I have, as I shared with you, a personal commitment and a long career working with farmers. I want to make sure I understand the very, very narrow margins, the slim margins that American farmers and ranchers are dealing with. And I don't want, under my watch, a single farmer to have to leave his farm for economic reasons or for regulatory or bureaucratic reasons while I serve, if I'm privileged to serve, to be confirmed as HHS Secretary. Even more important, President Trump has a very, very strong commitment to farmers. President Trump is probably historically in modern history the best farm president in our history. Farm income spiked for the first time in decades under his last administration. He got solid support from farmers across the country. Farm country is Trump country. Farmers across the country supported him during this election. He has specifically instructed me, and he wants farmers involved in every policy, and that he wants me to work with Brooke Rollins at USDA to make sure that we preserve American farmers, that all of our policies support them.
Mr. Kennedy, thank you. And if confirmed, I look forward to having you and Brooke Rollins out to Montana to spend some time with
You
our
have
farmers.
my commitment to come there anytime, particularly during ski season or hunting season.
Deal. I want to shift gears for a moment. As we discussed in the meeting we had in my office, mifepristone was approved in 2000. The FDA has been under scrutiny and brought to court for failure to properly assess this drug, as well as subsequent deregulations Senator Langford described that have occurred over the past 25 years. Some of these deregulations included ending the requirement that these drugs be prescribed by a doctor, ending reporting requirements for adverse events, and allowing these pills to be obtained through the mail. In fact, the FDA's own prescribing label mentioned that 3 to 5% of women taking this drug end up in the emergency room. My question is, if confirmed as Secretary of HHS, will you commit to working with the FDA Commissioner to review these deregulatory actions that are threatening the safety of women?
Sorry, Senator. As I said to Senator Langford, I think it's immoral to have a policy where patients are not allowed to report adverse events and where doctors are discouraged from doing that. President Trump has asked me to study the safety of mifepristone. He has not yet taken a stand on how to regulate it. Whatever he does, I will implement those policies, and I will work with this committee, make those policies make sense.
Thank you, Mr. Kennedy.
Senator Hassan.
Thank you, Mr. Chair and Ranking Member Wyden, and welcome, Mr. Kennedy, and to your family as well. I want to start with a couple of concerns I have, and just briefly, on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid.
As an environmental attorney, working with hunters and fishermen and mothers in a small town in the Hudson Valley and along the Hudson River, I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick also. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially. The United States has worse health than any other developed nation, yet we spend more on health care, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work. That's almost a fifth of GDP. It's tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for health and have better outcomes and a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to restore America's global strength and to restore the American dream, but he understands we can't be a strong nation when our people are so sick. A healthy person has 1,000 dreams. A sick person has only one. Today, over half of our countrymen and women are chronically ill. When I met with President Trump last summer, I discovered that he is more than just concerned for this tragic situation, but genuine care. President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement. This movement, led largely by Maha moms from every state, you can see many of them behind us today, and in the hallways and in the lobbies, is one of the most transcendent and powerful movements I've ever seen. I promise President Trump that if confirmed, I will do everything in my power to put the health of Americans back on track. And I've been greatly heartened to discover a deep level of care among members of this committee too, both Democrats and Republicans. I came away from our conversations confident that we can put aside our divisions for the sake of a healthier America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask, why are healthcare costs so high in the first place? The obvious